Absolutely fail-safe, and if the tracker loses control of the eye for any reason, it immediately closes down the laser, so it's a very safe procedure.
So Richard, remember this test from last time, just need to put
1 month after treatment, Richard has another checkup at the clinic.
I really felt like they cared. I wouldn't trust anybody else with my eyesight. They make sure that the process involves any retreatments that may be necessary, a checkup 3 days after surgery, 1 month and 3 months. They make sure you are absolutely okay at each stage before you progress to the next.
Side effects, of course, can occur, but in all my long experience of LASIK, I've never seen a serious complication that was not treatable. You can have undercorrections and overcorrections and haziness, but all these are adjustable.
Beth's decided to go ahead with the treatment. After having her eyes rechecked by the optometrist, there's a short wait before she's shown into the treatment room.
Okay, see you soon. It's a very simple process. They lie on the laser table. A little machine is applied to the eye, which creates a flap. Laser treatment will take a minute, maybe a minute and a half. The flap is repositioned. The second eye is treated. Yes,
the first thing you do is you line yourself up so you can see the red flashing light. Then they put a little clip in which keeps your eyelids out of the way, and that was actually quite reassuring. And really after that it's just a question of lying there and keep looking at the red light and let them get on with it.
It actually happens so quickly, you don't really have time to think about what's going on, and in terms of feeling anything, you actually don't feel a thing.
Everything went really well in the surgery. I'm now going to check the eyes on the microscope, make sure you're safe to go. Just pop your chin on the rest.
Immediately afterwards you're taken into a recovery room. I could see reasonably well at the time. Then Mr. Rosen checked my vision and basically told me I was free to go home and everything had gone really well.
So what we need to do now is just pop your goggles back on to make sure your eyes are protected overnight. Thereafter you won't need these. And you need to use your lubricant drops several times.
Immediately after surgery things are still a bit watery, and then just to compound that, put some plastic eye protectors over your eyes, and it probably feels gritty for a couple of hours, but the real staggering point is the following morning my vision was very good, and even more incredible was that I could not feel a thing.
Because of the drops and because of the flap, the vision is of course imperfect on the day of treatment, but most patients say they can see an immediate difference.
The morning after I woke up, it was absolutely amazing. I could see perfectly. I went and read a number plate across the road and could see it perfectly.
It makes a huge difference to patients. It generates enormous self-confidence in them, not just because they can see, but their self-image seems to improve dramatically.
Having perfect vision is absolutely amazing. It has really changed my life. I don't have to think ahead anymore. I can do exactly what I want without having to rely on lenses or glasses, to be able to see things clearly when I play sport, when I go on holiday, and just generally out and about and going out socialising. It's really good. It really is a miracle, and some days I wake up and I'm still amazed that I can see so perfectly.
As an optometrist, I'm probably the nightmare patient because we're very particular about how well we see. So for me to walk away from this and say, actually my vision is superb, it was probably the ultimate accolade.
I really wouldn't have gone anywhere else to have it done. Boots have got the best technology, really helpful and friendly staff who know what they're talking about, and the aftercare service is fantastic.
I can understand how people describe this as a miracle.
Good girl, there you go.
The transformation in your ability to see is quite amazing. Every morning when I wake up I kind of have to pinch myself to realise that I can see as well as I can.
Point you in.
My eyesight is really important. It's really precious to me. This is a small price to pay for something which will transform the rest of my life.